Hey, Dr. Shakib here from Irvine Spine and Wellness Center, your Irvine chiropractor. I am going to go over some of the things you can do as a treatment for your headaches. These are the things you can do on your own. Headache trigger points that you can I can show you, and also a headache treatment, natural and soothing treatment. It was what I was asked. So these are the questions that I was asked. So stay tuned. Thanks for watching. Let's talk about some of the stretching I do. By the way, I do the neck stretching at a specific time of the day, and that time, don't laugh, is when I'm in the bathroom. So I do my neck stretching when I'm in the bathroom. So the way you do it, I don't believe in static stretching where you go to a point and you hold it there and you press down. I really like, and honestly, in your body, everything has a flow and movement to it. So you want to go through, instead of point stretching, you want to go through a movement. So this is how you want to do it. You want to make sure that you're nice and straight, so your chest is nice and flat here instead of slouched forward, and then you bring your ear to your shoulder. That's the starting point. So let me back up here for a second. Pretend you're drawing a pencil, a half circle with a pencil that's attached to your chin. So what you want to do is you want to go all the way as far as it goes without tilting your head back or bringing this forward. So you want to go as far as it goes. Bring the pencil down because you're going to start drawing that circle. Bring it down. So you want to bring it down, draw the circle. So bring your chin as close to your chest as you can and go all the way here. Don't cut yourself short. You want to draw as big of a circle or half circle as you can. So go all the way here. And before you come up, make sure your head is not tilted. So you come up. So let's pretend I just came up. And now I came up nice and straight. Now I'm going to turn my head, bring my ear to my shoulder. Start going through the back circle. You see how my ear is now at this? I'm going to make sure it goes close to my shoulder. Come up, rotate, begin. So this is what it's going to look like. And I like doing it clockwise and counterclockwise. This really does the rotation at every single level in your neck, and that's what you need. Don't force it, but go incrementally increase it. That's how you want to do the stretching. The common trigger points that have to do with the headache are typically in your suboccipital area. If you have not seen the video I did on common types of headaches, this is the time for you to make sure you go back. I'm going to see if I can add it to the back of this video so you can see it right after. But they're in the suboccipital area at the junction of your clavicle or your collarbone to your shoulder area, in that area, and at the base of your neck, where your neck gets connected to your upper torso area right here. Those are the common areas. There is another area more around the scapula or your shoulder blade. That's a little bit hard for you to do. I am able to do it myself, so maybe you can. And I'm going to see if I can turn around here. So what you want to do is you want to place your hand, opposite hand, on the side that you feel it's tense, and find that sore spot. And you don't want to put your finger softly over the area. You want to make sure it's nicely pressed in. You're not fighting it, so just press firmly, and then move your arm into a rotation like that and bring it back and forth. Kind of move your arm parallel to the ground and start moving it around and just play with it and see which spot you feel a little more relief, feels good as you're doing it. So these are really natural treatments for it. The stretching specifically was the reason why I started doing this video, because I really don't like these do this. You really don't need to be doing this. Your head is this way anyway. If anything, I strongly recommend you do more extension exercises where you're looking up and your body's opening up instead of going into the flexion. There are a couple of exceptions, but that's about it. If you have not checked out my website, I have an ebook there with 17 tips on the things I do. I couple them with the activities I do so I don't spend extra time doing them. And I really think you guys should take advantage of it. Those are the 7 things I do every single day. Also, if you have not subscribed to my YouTube channel, this is the time to actually subscribe. What do you have to lose? And also follow me on my Facebook page, Irvine Spinal Wellness Center. That's where I typically interview an outside expert on a specific subject which I determine for each month. And that's where you see those videos available to you. These are resources I have for you because I firmly believe you are the director and the designer of your own life. And if I can give you whatever tools you can do on your own to take a better control of your life, then you will enjoy your life for much longer and better quality of life. Thanks for watching. Take care.